sometimes in order to measure the CSF pressure also, electrodes are placed within the lateral ventricles, because when there is an excessive amount of the CSF being secreted, shunting can be done. And these shunt can be a programmable shunt also. What do you mean by a programmable shunt? Is what happens in a programmable shunt is like that the physician places a device subcutaneously, and this would allow a kind of a threshold pressure. Whenever the threshold pressure is being exceeded, in that case a shunting mechanism begins to take place, or where the fluid is being drained into the body cavity. This reservoir is actually a subcutaneously placed pump, or it is a device that is placed within the subcutaneous scalp region, and this measures the pressure changes in the brain. The physician will monitor the activity of the brain via these monitoring or depth electrodes, and then in a more radical approach he can also go for a lobectomy of the particular brain where there is excessive activation of the epileptogenic focus. And coming to SRS, which is a stereotactic radiosurgery, here what happens is precise locationing of these targets. These targets are sites which have specific functional activities. Say like these are the areas that cause the excessive tremors, as in psychiatric conditions like schizophrenia, or in severe psychiatric conditions, or of course in epilepsy. And the provider is trying to locate these targets in a three-dimensional space, and thereby he then passes this radiotherapy as a mechanism to treat those sites that are the actual cause of such onset of tremors or psychiatric ailments. So when the physician is making use of a three-dimensional techniques, then we call that as a stereotactic radiosurgery.